This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222. Let's talk about surrogacy. Surrogacy is relatively uncommon. What we mean by surrogacy is a baby being carried by another woman to allow a pregnancy to happen in a woman potentially who has been unable to conceive. Which women are unable to conceive that would consider surrogacy? Well, there is a small group of women who are born without a uterus, and although they have ovaries and they can produce eggs. So that's one group who finding someone else to carry the baby would work, and it would be their genetic baby because the embryo that was created with the eggs we collected would be put with a partner's sperm, and that pregnancy genetically is theirs. Another woman would carry it. The next group are women who've lost their uterus. So a woman with cancer, for instance, who's cancer of the cervix or cancer of the uterus, who still has ovarian function, and the eggs can be used to create a pregnancy again with a partner, and another woman could be carrying it. I've certainly had surrogacy in a 30-year-old lady whose mother, aged 54, carried the baby for her after she had her uterus removed because of cancer. So it is possible. Then there is a group of women who go through cycle after cycle of IVF, and we're putting back good embryos, even embryos that we've proven genetically to be normal, where there should be a 50 to 60% chance of a pregnancy. After 3 or 4 transfers of those embryos, they may decide that we may decide, and they may agree, this might be related to the uterus, and therefore putting those embryos into another lady's uterus. In America and Chinese ladies, I've just recently been there, and apparently there's quite a big market in not having to carry your baby yourself if you can afford it, and having some other woman go through the process of carrying your baby and then you taking it home. That's really 21st century stuff, and not really. And indeed in Australia, for that purpose, our ethics committees would not agree to do surrogacy on that behalf. Although I do understand there are women travelling to America to do so. Finding a surrogate in America is more straightforward if you've got the money. I was at a conference recently and talked to 2 or 3 surrogacy agencies, and you're talking something between 150 and 300,000 Australian dollars to have a baby through surrogacy in the United States. It's you really have to want to do it, and I have had patients go there and be successful. There's no question of that. In Australia, we can't pay the surrogates for carrying the baby. Our system in Australia is all about altruism. We give blood, we don't get any money for it, etc. Give kidneys, we don't get any money for it. In the United States and in many other countries around the world, carrying a baby may earn the carrier somewhere between 50 and 70,000 Australian dollars. So it's not surprising that in places where it's legal to pay, there are ladies who would see that as a good 9 months' work, being paid that sort of money. In Australia, there are surrogacy websites, and there are women in Australia who will do it altruistically. It's not quite altruistic because we're allowed by the regulations of the Human Research and Ethics Committee of the Australian Government to pay, in quotation marks, reasonable expenses. That number is not laid down, but a court case a couple of years ago in Queensland suggested it might be around about $25,000, which still might be an inducement for someone to carry a baby. So there are surrogacies go on in Australia. The numbers I think in 2022 was something in the order of 250 surrogate cycles carried out in Australia. Not all of them were successful in terms of embryo transfers and having a baby, but there certainly are some happy couples where surrogacy has worked for them. To go through surrogacy, there is a significant counselling process, and the clinics that do deal with surrogacy, and we certainly do at Life Fertility Sydney, those patients, both the donor and the surrogate and the commissioning parents, have to get legal advice, because obviously, as has been shown in America, there are moments in time where the lady that carried the baby through the pregnancy suddenly turns around at the end of the pregnancy and says, I'm going to keep this baby. So we need to make sure that's not going to happen, and that's legal documents. The other thing that we insist upon is that the eggs that are used to create the surrogate child are not those of the surrogate, because in law, that woman actually has, being the genetic mother of the child, has the right to keep the child. So we avoid that, to avoid that issue of legal fight over whose baby it is. So surrogacy happens. From an IVF perspective, it's fairly straightforward. And the biggest issues are around the legal and the psychological issues for carrying a baby in that sort of arrangement.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.